Landspítali, we have been embracing on a patient safety journey and continuous improvement for a number of years. This really came into the spotlight after the economic crisis, when we had to really think about how to use our resources effectively and really safeguard patient safety and put the patient first. So we've looked at a number of leading institutions and learned from what they've been doing. First, I want to mention Cincinnati Children's, the NHS, and Virginia Mason, where we have really learned about their lean journey.
My work here with Landspítali has been fantastic. It's an opportunity to rethink how a healthcare system delivers patient experiences.
So we have a number of methods to train our staff in lean, anywhere from basic introductory courses for all new staff up to more sophisticated courses and workshops for managers and leaders.
We started implementing this in 2012, started slow, but now we have at least 50% uptake in the hospital and most of the clinical areas covered, working on more of the support staff and support services. What we have is daily safety meetings, situational awareness meetings or huddles, that take place in each unit, and then we have one large meeting for the hospital. The goal is really to look at things that can be predicted and prevented. We believe that this has really helped us prevent crisis in our hospital, and some of our staff have really vocalized pleasure, and some people have even said that it's the first time that they feel like they know what's going on in their hospital. We've used lean as one of our main tools to continuous improvement at Landspítali for the past few years.
The lean thinking that has been embedded in the Landspítali system that's really allowing this work to come forward is a way for the world to say, here's a highly effective application of lean in healthcare. I think everyone can learn from that.
Probably what we've used most is 5S for standardization, simplification, and really use this all over our hospital to redesign our medication rooms and a lot of the clinical environment. We've used Kaizen for a number of projects, and then lately we've been using 3P to design our future hospital, a really, really exciting project.
We've started with workshops to design individual service units. So we've done 5. The 5th one that we've just are finishing up is really looking at, with each design, how does it come together and relate to the existing facilities. With an eye on facility design, we can't really do that without fundamentally rethinking our processes. And so each time a team has been able to come together and think about a future floor, they're really thinking about a way of providing better care. And that will translate to the processes they have today and the spaces they have today. They can improve those, really helping them embed the triple aim of the IHI into the care they provide every day.
We have implemented patient-centered, coordinated ward rounds that emphasize patient safety and participation of the patient in the rounds. They also emphasize teamwork, and what's particularly interesting is that there is actually a script that has been written so that everyone's role on the team is much clearer. We have been able to implement dashboards in many wards and clinics in the hospital, and the ultimate aim of the dashboards is to increase patient safety. They show information about pain, about nutrition status, and the latest development is that we now have a doctor's orders also on the dashboards. So this means that the clinical staff can quickly review the situation on the ward and quickly see which patients are in the most urgent need for care. The emergency room pioneered this approach by developing meters that actually you can read in real time, and you can quickly see how many patients are waiting in the ER, for how long have they been waiting for a bed, for how long have they been waiting for a physician, for example. And these real-time data are helping us significantly from minute to minute to watch over patient safety.
Our main focus in all of these projects is to prevent patient harm. And to be able to do that, we are gradually implementing an open culture, a culture where we learn from mistakes. Combining this with situational awareness, standard work and lean will help us prevent patient harm. And we will continue on this journey.